So a question I often get is about cleaning is there's this thing in the business, how many times you're supposed to get your teeth cleaned, and everybody here is supposed to get my teeth cleaned twice a year. Well, I'll say it like this, and the joke I often use is that twice a year usually is for kids that are 25 and under. Yes, I said 25 is kids who haven't had their teeth long enough to really have usually that many issues. For most of us, one of the most common diseases in the world is gum disease, or some of you may call it pyorrhea. We call it in the profession periodontal disease. And periodontal disease is simply a bacterial infection, eventually leads to some bone, loss of bone, irritation of gums, etc. And if it's not treated long term, it can actually lead to tooth loss. But I basically say it like this: for most of us, if we maintain our cleanings twice a year, the hygienist will actually do a measurements of the gums and the bone. If it turns out they're starting to get any sort of bone loss, then they may recommend cleanings maybe 3 times a year. All right, it's very common, cleans 3 times a year. And once the infection is under control, then we put you into what's called the maintenance program. And we still may see you maybe every 3 to 4 months. But as long as you maintain those cleanings and everything's fine, then you can keep your teeth mostly for a lifetime. Someone that tends, again, to be diabetic, maybe certain other disease or conditions. Let's say if your mouth tends to be very, very dry, you may be more prone to have gum or periodontal disease and or cavities, or getting cavities. So these are things that we can actually talk with your hygienist, talk with the doctor when you have an exam, and we can come up with a treatment plan for you so we can make sure that you maintain your teeth for a lifetime. There are situations where if by chance that in certain areas where we're not able to maintain the teeth being cleaned as well, or if we have lots of bone loss already, then we can talk about other alternatives so that we can make sure that you can actually have some teeth or dentures or a bridge or some, obviously attached implants where you can basically function, chew, do all things that you would like to do. Because, let's just face it, one of the most pleasurable things we all like to do and enjoy is eating with family and friends. And so if you haven't been able to do that for a very long time, then I think you should come in for a consult. We won't scare you, but we'll definitely tell you what your options are so we can try and get you on the road back to dental health. During professional cleaning, if you are a first-time patient, we will get a full set of x-rays, do gum measurements to let you know where you're at, and then we go on from there. If by chance you don't have any gum disease, then yes, most likely then twice a year would be good for you. If, let's just say it turns out you have active periodontal disease in certain areas, which often you can tell by if you're brushing, if you tend to have bleeding that tends to linger, or maybe certain odor in your mouth, we get you on in, we get those areas cleaned up for you. And what we usually do is once everything is clean, we'll do what's called a re-eval appointment, which will bring you back roughly about, perhaps up to about 8 weeks. We'll check those areas on out. If everything is good, we'll put you on a maintenance program. And once you're on a maintenance program, we usually see you maybe 3 times a year, maybe every 3 to 4 months. And as long as those areas are healing, they're fine, and they're not bleeding again, then we won't have to do any more what's called deep cleanings. So usually if the doctor's doing deep cleanings, that's because you usually have active gum disease. But once the gum disease or periodontal disease is put to a stop, then the deep cleanings may not be necessary. We come in to make sure everything's okay. We clean you up, and we just make sure that nothing continues to get any worse. You should actually come on and see us about preventive care. Reason being is that because even though we do a lot of advanced types of dentistry and all those other type of things, there's nothing better than your own teeth. And if you can maintain those teeth for a good, very, very long time, that is something that we will strive to. Because again, there's just nothing better than having your own teeth. I'm an implant doctor. I place implants all the time. But if I can definitely reasonably save a tooth and it's not going to cause you any issues in the future, then let's do what we can to maintain your teeth. But again, we are a heavily preventative-based practice, and we want to make sure that the teeth that you actually have, if we can reasonably keep those, that's what we're going to try to do. Personalized care is what we'll do is we'll do a set of x-rays. Then we will actually do gum measurements, which is actually on a computer. We can show you what those measurements look like. And then we simply come up with a plan for you. There are some patients that may not necessarily have active gum disease. We'll just maintain you. If you do have active gum disease, then often, in particular, say area of the mouth, it may only be 1 or 2 teeth that actually have the active disease. We'll clean around those teeth or do the deep cleaning. Then everything else we'll do basically regular cleaning. If there's more teeth that need the deeper clean, we'll take care of that. So the point to that is that the personalized plan is based on the measurements that we find and not just on some script that some people may say that doctors will use.